Very good morning to all my dear learners. How are you everyone? I hope you all are safe and fine in your places. And I truly believe that really this learning process is going on well. So welcome to the ocean of physical education. As you all know that this is your part number 8. And we are going on with unit 7. The name of our unit is Physiology and Sports Injury. Physiology and Sports Injury. Right, students? So before this lecture, we have already covered all the physiological part, like the physiological factors which affect endurance, physiological factors which affect speed, physiological factors which affect the flexibility of an individual. What are the factors on which this all physical fitness component, that is the endurance, flexibility, speed, coordinative ability, etc. In this session, we'll be going to learn about sports injury, or we'll be going to learn about sports science or sports medicine. Let's begin this session with the topic sports medicine. Whenever I'm talking about sports medicine, so sports medicine is the branch of medicine. It is a branch of science, we can say. It's a branch of sports science. Which deals with first thing, if we are talking about sports medicine, it is treatment, which deals with treatment, prevention. Okay, first aid. After first aid, that's the diagnosis of injured athlete. Got it? So basically, the sports medicine is dealing with the it's a branch of science which deals with the prevention, treatment, curing, first aid of an injured athlete. So whenever there is an injury, as you know, see, when we play football, when we play any game, whenever we are in the arena of sports, injuries are so common. Sometimes on skin, sometimes severe, sometimes normal. So these injuries are really, kind of happen anytime, anywhere. Right, in sports if we talk about. So today we will be going to understand what exactly the sports medicine is, what is the classification of the sports injury, and we are going to learn so many things. Right? So let's come, we will start our topic. So today first thing that I am going to tell you is about first aid. Okay? Our first topic is first aid. First aid is what? First aid is the immediate treatment to an athlete, to an injured player. First aid consists of first aid box. First aid consists of the immediate help to the player, immediate kind of response, so that the health can be prevented, so that if there is some problem, so that problem can be corrected. Got it, students? So it's basically meant for this first aid if we're going to talk about. So it is basically for basically to help the children, right, to help the players. So sports medicine is also known as exercise medicine. First thing that we need to keep in mind. Okay, so sports medicine is also a branch of medicine that deals with the diagnosis, treatment, prevention of injury, and all whatever kind of injury which is occurred in sports. So the injury occurred in sports, we basically deal with that. Got it? So sports medicine is basically to include the assessment, the management of patients with musculoskeletal injury, medical problem arising due to sports activity, the sports physician, and the various kinds of things like rehabilitation with nutrition, biomechanism, exercise physiology, psychology, so many things. So this people, the person who belongs to the sports medicine is basically concerning about all these things proper, right? There is also International Federation for Sports Medicine, which basically deal for it. So we have an International Federation of Sports Medicine, FISM, right? It is a body which provides the guidelines for the sports injury. Its functions not only curative and preventive, but also rehabilitative. Right, students? Now the next thing that I'm going to tell you is about the curative measures, right? The primary focus of a sports medicine is rapid and full recovery of a patient. If we're going to talk about the thesaurus, he has given the definition, and this definition is basically made for the, it's if we talk about the sports medicine, there is an exact definition we have, and the definition is it's a branch of medicine concerned with the treatment of injury or illness resulting in athletics activity. According to Webster College Dictionary, it's a branch of medicine concerned with the athletic condition and nutrition, the treatment and prevention of athletic injury, and movement of athletic performance. So, this first aid was basically, it's a temporary care to the victim. If you talk about first aid, so it's a temporary care given to the victim, and it is given by St. John Ambulance. Okay, it is given by St. John Ambulance Association in 1879. So it is given, it is on 1879, this initiative was 1879, and this association was named St. John Ambulance Association. So basically, when we talk about first aid, so first aid, the basic or the major concern is about the temporary care, the first care. Like for example, if there is a lot of bleeding during an injury of a spot, so the very first thing, the very first aid responsibility is to stop that bleeding, so that the loss of blood can be cured. It's our immediate treatment, right? So first immediate and second is A, B, C. It means airway, breathing, okay. Next is compression. Whenever we talk about airway, breathing and compression, it is basically means, sometimes it's happened that the person who provides a first aid to victim should one should know that whenever it is required, a person should go for A, B, C. That's the airway, B for breathing, and C for compression. Got it? So first aid is the major objective is to save the life of a person. What is the first objective of this first aid? The first is basic objective is to save the life of an individual. Got it? So immediate aid, it means if possible the first aid should be provided immediately. At the time we should not think about useless things. Time is very precious at that moment. So without wasting time, we needed to take decision, and it should be taken immediately, and care should be given to the victim. If we talk about ABC, so one should think about ABC. ABC is airway, breathing and circulation, or sometimes compression. So we can use circulation nowadays, it has changed, right? So the person who provided the first aid to the victim should know about the ABC, that's the airway, breathing and circulation. So that first of all they should check the throat of the victim, airway is going inside or not. He should unbutton the shirt of the victim and should check his respiration. If the victim's respiration is not running well, he should give him, he or she, whoever is there, should give artificial breathing to him. It is providing breathing to that person. Got it? After that person giving first aid should check the blood circulation, is that the blood circulation is good or not. So they should go for CPR, cardiopulmonary circulation technique immediately. The process of artificial respiration is given after the chest is pressed, artificial blood circulation, and it must be repeated after at least 15 times. Okay, so it's circulation, not the compression, right? Circulation, right? Airway, breathing, circulation. Next thing that we need to keep, if there is bleeding. So very first thing is to stop bleeding. What is the very first concept? If it is bleeding, if there is bleeding, so very first thing that we need to go, or there where we should go, is that stop bleeding, right? Which is the one of the major thing that we always need to think. Stop bleeding. Got it? Now see, when you have you look on it, and when you see someone, there is a bleeding due to accident, the first requirement is to stop that bleeding. Next is to keep the crowd away. Keep the crowd away. See, when there is a sports injury or whenever there is a kind of injury, and when a lot of people come together, so the person becomes nervous, and there is a sensation of feeling unwell. So it's very important whenever there is an injury to an individual. So the very first thing is to have a sympathetic attitude and to keep the crowd away, so that the air can come, he can inhale, he can have a great amount of oxygen with him, so that he can not feel that kind of nervousness. Right? So wrap the injury with cloth or kind of so whatever is equipments you are available on that time. So what we can use it, wrap, or what we can use, or what we can say is about the, yes, we can say wrap. Wrap the injury with cloth or blanket, or whatever kind of material you have there on that time. Right? So whenever you have things with you, like whenever there is an injury and it's a severe injury, like the bone is come out while doing something. So whenever there is a serious kind of injury, so very first thing is to cover the injury, so that the microorganisms of the pathogens will not start attacking on it, and there will not be any great problem. So first thing is to keep the crowd away. Second thing is to keep the things, any problem or whatever the kind of injury, so just wrap it down. Right? Very first and very important thing is sympathetic attitude. Sympathetic attitude. When we talk about sympathetic attitude, it means whenever whenever there is an accident, the person becomes nervous, the person becomes lethargic. Okay, so we need to give a sympathetic attitude to yes, dear. No, don't worry about anything. We are with you. Everything will be fine. Just don't worry about it. Because if आप nervous होते हैं, the mental temperament is something, and things become may go on the wrong side. So one should give a sympathetic attitude to that individual. That's the very important part, right? Fluid should not be given to the conscious person, right? It means the unconscious person, right? So it is very important to think that we should not give, right, to the person who are unconscious, right? So there is nothing, no fluid. be given to the unconscious person. Okay, so fluid should not be given to the unconscious person, otherwise it may happen that the liquid is go inside the windpipe and there will be a lot of problems, right? So it's very important to note this thing that whenever when someone faints, so what we generally do is to just bring water, थोड़ा सा पानी पिलाओ सब अच्छा हो जाएगा. It is not at all like that. Whenever someone is unconscious and if you are providing water to him, it may occur that the water that you are providing is rather than going into the food pipe, it will go into the windpipe, that is the lungs. There is a lot of sneezing and there is a lot of problem. So one should not go for all these things. The very important thing is medical aid. Medical aid means I'm basically talking about one should go for to visit the expert doctor so that the things can be covered and so that we can got to know that what exactly happened. Basically the solution of the problem comes to our end and we get to know that what to do or what not to do. We'll basically understand it, yeah, we'll have to understand this thing, right? So cardiopulmonary respiration, okay, and AB, that is the artificial breathing. So let's recapitulate it, what we were studying. The very first thing that we need to keep in our mind is first aid. First aid is given by St. John Ambulance Association and it was in 1879, right? When we talk about first aid, so first aid is just an immediate response. It is just an immediate response. This response actually is done by the St. John Ambulance Association and it is the immediate treatment to the injury whatever occurred. We need to keep some things in mind whenever there is a sports injury or whenever there is an injury and whenever you are giving some first aid. Whenever you do for first aid, you should know about ABC, airway, breathing and circulation. You should know about AB, that is the artificial breathing. What is AB? AB is the artificial breathing. Artificial breathing. Got it? So we should go for airway sometime whenever it is required. So we should give the artificial breathing. Breathing, we should check that the throat is proper, the respiration is going on well. We should press the chest regions of the circulatory system. The heart working will be started working properly. We should think about stop bleeding first. It should be our first aim that the blood should be stopped so that the loss of blood can be controlled. Next thing is we need to keep the crowd away, right? If you keep the crowd away, it's become very good because whenever we keep the crowd away, the oxygen will come to that person, he'll be feeling fresh because the air with him. Wrap the injury with cloths, so a blanket. So it's very important again to wrap the injury with the blanket or with the cloth, okay? So the pathogens will not attack. And Ambulance Association, if you talk about, so they also suggested us that fluid should not be given. There is a rule book in that. So fluid should not be given to the unconscious person. Otherwise, the fluid will go into the that wind pipe rather than going into the food pipe. So again, there will be maybe a severe problem or there may be a death of a person. Medical checkup means we should go to the doctor and we should must visit after the first aid to the expert doctor so that we can understand what exactly happened and what are the problems that the person is facing and how to cure all these problems. Okay? So I hope this much part is clear to everyone. Now we are going to start a new topic, and the new topic we are going to learn the flowchart now. After this flowchart I will explain everything in detail, right? So let's begin with classification of sports injury. Let me just grab it. Okay, so our topic is classification of a sports injury, right? Classification of sports injuries. Whenever we talk about the classification of the sports injury, we need to understand first what is the injury. So injuries is something when our body gets harmed, when we feel pain, right? So there are two things, soft tissue injury and hard tissue injury. So the classification of this sports injury is of two types. That's let me tell you. First is soft tissue injury. And the second point is the hard tissue injury. Hard tissue injuries, right? So hard tissue injuries and soft tissue injuries, right? If we're going to talk about soft tissue injuries, so soft tissue injuries are basically divided into two types: skin injury and muscle injury, right? Soft tissue injury are divided further into skin injury and muscles injury. Skin injury and muscle injury. Got it, students? Okay, so right. So soft tissue injury, if I'm going to talk about, soft tissue injury is basically concerned with the injuries occur on skin, injuries related with the muscle, right? Like there is a cut, there is an incision, there is a contusion, there is a laceration. So these all things are related with the skin injury. Whenever there is a cramp, there is a strain, there is a sprain, these all things come under the muscle injury. Got it? So soft tissue injury is divided into two parts, that is the skin injury and muscle injury. I hope this much part is clear. Got it? So let's begin and understand the things properly. Whenever I am talking about skin injuries, the injury which occur on skin are called skin injury. Got it, students? Very first thing in the skin injury is contusion. Okay? So contusion, whenever there is a blunt object, आपको किसी ने बेसबॉल के डंडे से थाई को बहुत जोर से मारा on your thigh, right? तो आपको आपकी थाई के ऊपर there will be blue, green patches, black, blue, violet patches बन जाएंगे, आपकी मसल के अंदर बहुत जोर से पेन होगा. That is the contusion. जब आपकी मसल्स ब्रेक रही हो और आपको ब्लंट ऑब्जेक्ट से मारा जाए, that is the contusion. हॉकी खेलते समय लगभग जनरली ऐसा होता है. It happened with me, right? तो ये बात की मैंने इस बारे में we had a conversation about the contusion. Second thing, if you talk about is laceration. Contusion, laceration, incision. Okay. So this skin injury we're going to talk about is basically of four things, right? First thing is contusion, second is laceration, third is incision, and the fourth one is abrasion. What is the fourth one? Abrasion. What is abrasion? What is contusion? What is laceration? When I'm talking about contusion, it means आपको किसी ब्लंट ऑब्जेक्ट से मारा गया है. Laceration यानी डीप कट हुआ है. Incision यानी सिर्फ कट हुआ है. और जब मैं एब्रेशन की बात करता हूँ तो जनरली आपके एल्बो वाला रीजन, आपके नीज वाला रीजन, ये रीजन कुछ ऐसे होते हैं जब आपके हाथ घिस जाते हैं ड्यू टू फ्रिक्शन. आपके पाम वाला रीजन, आप चलते चलते गिरे, आपके पाम में लगेगी, आपके घुटनों में लगेगी, हो सकता है आपके एल्बो में लगेगी. ओके, तो ये क्या होता है एब्रेशन. जब आप किसी चीज़ से घिस जाओ, when you falling down there is a abrasion due to friction with the another surface. दीवार से आपको घीस दे कोई पकड़ कर, है ना, ऐसे पकड़ कर ऐसे कर दे, आपकी गाल पे क्या होगा, there will be abrasion. ओके, so abrasion, laceration, incision, ये सब किस पार्ट में है बच्चे? These all things are in the part of skin injury. So whenever we talk about skin injury, there is contusion, laceration, incision and abrasion. Let's have a talk about muscles injury. When we talk about muscles injury, there is a strain. There is a sprain. Okay. So muscle injury is basically concerning with a strain, sprain, cramp. You must have aware about cramp. Cramp is general problem. Generally occur. Let us suppose कि I am just giving you one example. जब कुछ बच्चे जो फिजिकली फिट नहीं होते हैं और फाइनल एग्जाम के प्रैक्टिकल वाले दिन जब रनिंग करते हैं तो क्रैम्प होने स्टार्ट होता है, यानी कि मसल्स की जो इलास्टिसिटी है, जो कंप्रेसिबिलिटी और जो एक्सटेंसिव जब मसल्स का फैलना फिर कम होना, लाइक आप दौड़ रहे हो राइट, कंटिन्यूसली आप दौड़ रहे हो तो मसल्स कंप्रेस भी हो रही है, रिलैक्स भी हो रही है. ऑन दैट टाइम दैट क्रैम्प ऑकरेंस इज मोस्ट, बिकॉज आपने इसके पहले कभी एक्सरसाइज नहीं करी, योर मसल्स डू नॉट हैव दैट मच स्ट्रेचेबिलिटी, दैट मच पावर. आपकी मसल्स का लैक्टिक थ्रेशोल्ड अच्छा नहीं है कि वो लैक्टिक एसिड को टॉलरेट कर पाए. सो आपको यू शुड स्टार्ट रनिंग, यू शुड स्टार्ट डूइंग वेरियस काइंड्स ऑफ एक्सरसाइज फ्रॉम नाउ डेली. ओके बच्चे, so this is about the skin injury, or if I will talk about this soft tissue injury. So whenever we talk about soft tissue injuries, basically skin injury, muscle injury, right? When we talk about muscle injury or skin injuries basically consist of contusion, laceration, incision, abrasion. If we talk about muscle injury, so muscle injury consists of strain, sprain and cramp. Got it? Now the point is that what is a strain? What is a sprain? So it's very important to explain this thing also. Cramp, if we talk about, it's a neuromuscular problem injury, right? When muscles cannot contract properly. That is what? The cramp. When we talk about strain, so strain, it is a damage or breakdown of the ligaments, or sometimes it may be overstretch. So whenever the muscles overstretch, that's what? That's the strain. Strain is also called muscle pull. What we call to strain also? Strain is also called muscle pull. Next thing is sprain. Okay? Next thing is sprain. What is sprain? So when we talk about sprain, sprain is it's basically a soft tissue injury which is related to the muscles, and it's a damage or breakdown of the ligament, or sometime when the joints are violently stretched, we call that problem that the strain. This much part is clear, right? Next thing is bone injury that we are going to talk now, right? So hard tissue injury is basically it may be bone injury, or it may be combination of muscles and bone injury, right? So hard tissue injury of two things, right? When we talk about hard tissue injury, so hard tissue injury having two things. One is bone injury, and second thing is bone plus muscles, right? So when we talking about bone injury, it means there is a fracture. Got it? When I am talking about bone injury, it means there is a fracture. We are dealing with the fracture. Whenever we started to deal about fracture, so fracture is basically what? Fracture is, it may be minor, it may be major. So any injury to the bone is called fracture. Okay students, what I am saying exactly? I am telling you about the classification of sports injury. So whenever there is a problem regarding what? Regarding the hard tissue. That's the bone injury. So bone injury, if we talk about fracture. For fracture, after that we have next thing, that is the dislocation. So if we talk about the dislocation of shoulder, so the dislocation of shoulder may be interior, may be posterior. So dislocation of bone may happen, right? So two things in hard tissue injury. One is the bone injury. It means there will be a fracture. Fracture may have different things, like hairline fracture. Okay, hairline fracture. structure, right? After communicated, there will be spiral, okay, oblique, okay, mixed structure, severe, and combination of this, right? So any injury, let's suppose this is the bone, okay, if there is this kind of fracture, it means in your bone there is a hairline fracture here. Sometimes it may be displaced, इतनी bone टूट जाना, right? So और कभी कभी communicated की अगर मैं बात करूँ, I am saying about communicated fracture, तो communicated fracture का मतलब होता है छुपा होगा ना bone का टूटना, got it? So fracture, it means the injury occur in the bone, got it? What I am saying? I am saying whatever kind of fracture or the injury occur in the bone are we termed it as the fracture or the fracture. Fracture, it means the things which is related to the bones. If I am going to talk about the dislocation, right? So dislocation is an injury which is related to the adjoining bones from their original position. When your bones are displaced from the original position, right? So whenever your bone is displaced from your original position, we called it as a dislocation. Now if we talk about fracture, okay, so fractures are also of two types. Fractures are also of two types: open fracture, closed fracture. Generally, the closed fractures are not that much severe, but it is very painful, and there is generally a kind of swellings and all happening. When we talk about open fracture, so open fracture, the example is that when the bone come out from the body part. Okay, let's take an example. अगर मेरे हाथ में अगर पाँव में ओपन फ्रैक्चर हुआ है, तो मेरी जो हड्डियाँ हैं हाथ की वो बाहर निकल आएंगी, which is severe, too much severe, right? So that is what this fracture. If we talk about bones or muscles, तो जब as you all know कि मेरा जो body का, let's talk about my shoulder dislocation. अगर मेरा ये dislocate हुआ है, मतलब या तो मेरा हाथ आगे हो जाएगा या पीछे हो जाएगा या नीचे हो जाएगा. It means dislocate हो जाना bone जहाँ पर है वहाँ से from the original position if the adjoining bones are displaced, we call it as dislocation. ठीक है? Now the injuries are also of two types. It means the if you're going to talk about on the basis of कि कितना severe है क्या है. So injuries are of minor injuries and major injuries. So minor injuries are soft tissue injuries and major injuries are hard tissue injuries. तो ये जो soft tissue injuries है, these are minor injuries. Minor injuries. और ये वाली जो all these है हमारी, ये है हमारी major injuries. What are this? Major injuries. So these are major injuries. These are major injuries and that are minor injuries. Let's recapitulate what exactly we had started and what is the meaning of it. So we had started a session with the first aid. First aid is what? First aid is the immediate care given to the victim. Second thing, we had done the classification, right, of the sports injuries. Before it, we had also understood that first aid we should keep the crowd away. We should think about ABC, airway, breathing, circulation. We should think about to wrap the injury. We should think about after the curing of stop the bleeding and all and etc. We should meet to the expert doctor after giving the first aid. The basic objective of first aid is to save the life of an individual. If we talk about the classification of sports injuries, it is of two types: soft tissue injury and hard tissue injury. When I am talking about soft tissue injury, it is of two types: skin injury and muscle injury. Skin injury consists of contusion, laceration, incision, abrasion. And muscle injury consists of sprain and tear. Now, if I am talking about the heart tissue injury, so heart tissue injury consists of so many things. Bone injury and bone plus muscle injury. When we talk about the bone injury, it consists of fracture. Fracture may be open fracture, fracture may be closed fracture. When we talk about bones and muscle, that is the dislocation. It means when the adjoining bones are displaced from the original position, right? So this is what all about this part 8 of this chapter. This is totally telling us about the injuries, that is the major injuries, minor injuries, its classification, and so many things, right? So I hope you all got this concept properly, and the session must be fruitful for you everyone. So with this, take care. Bye. Lots of love and blessings to you all. We'll meet soon with the next lecture, with a new comment, with the new content, so much.